Hi, I'm Dr. Matt Sheehan from Medford Family Chiropractic Center in Medford, Oregon, and I'm joined today by my friend Angie Orr, who is a licensed massage therapist here in the Valley. And we're here today to demonstrate a stretch for the low back and the pelvis that I use frequently with my patients. And I like to put these on video because sometimes when I demonstrate them in the office, by the time patients get home, they've completely forgotten what the heck it was. And they can refer to my website, medfordfamilychiropractic.com, and see most of my stretches and strength exercises on there, and it makes it much easier to remember. If you're a patient of mine, you probably recognize this sheet, and I just want to show you that this is the exercise that we are demonstrating today. So you can look through your sheets and find this particular one, and there we have it. So what we're going to do is we're going to have Angie go flat on her back, and we'll set her up for the stretch. Angie has not done this with me yet. She probably has. Have you done this one ever before anywhere?
I just do, yeah, on my own time.
She does it on her own. Great. So anyway, sometimes when somebody's never done it, it's good because they're similar to a patient. She might think of some questions to ask to help her understand it, similar to you as a patient. So what we want to do, this is a rotational stretch, and one of the beauties of this stretch is it'll show you where your tightness is, and it could be in a completely different place on one side than the other. A lot of times when patients do this, they'll feel it in their gluteal muscles on one side, and then when they switch and go the other way, they feel it totally in their low back. So it's really good to help you understand where you're the tightest. So what we're going to do is we're going to have Ange bend your knees up for me right about there, and you're going to cross one knee over the other.
Doesn't matter which one?
Doesn't matter which one. There you go, just like that, just relax. So you want to do it like this as opposed to, quote unquote, maybe more guy style, something like that. This is less effective. We want the knees together, and you're going to have your hands. At home you can do it on the floor. If you can get down and back up safely, you can also do it on your bed. It doesn't work on a couch, but it'll work on a bed as well. So you're going to start out like this, and what you're going to do is you're going to, on the leg that crosses over the other one, you're going to continue in this direction like this. So that leg's coming over to the other side. And what you're going to do is, what you want to pay attention to is, when I show stretches, I'm showing them to injured individuals, wounded individuals, so to speak. And so that's different than someone who is quote unquote healthy and stretching on their own, where you can get away with a lot more. Here, you want to be totally focused on what body part you're trying to stretch. Don't be thinking, did I leave the stove on or something else? Pay attention to this, and you want to go slow with the implementation of the stretch, because if you do it too fast and you're not paying attention, you're going to blow right past the point where you start to feel a stretch, which is the goal is to get to that point where you're just starting to feel the slightest amount of stretch, because that's a safe place. If you go past that and stretch too far, you risk worsening your strain of your musculature. Okay? So at the point where you start to feel stretch, even if it feels like it's not doing anything, ignore that voice in your head thinking, this is stupid, I really need to stretch the heck out of it like the old days. Ignore that voice, okay? The start of a stretch, and you, like I said before, you may feel it in your low back, you may feel it in your gluteal muscles, you may even feel it in your hamstrings or behind your leg. Do you feel any stretch there at all?
A little bit in my glute and a little bit up in my back.
There we go. So with this, best way I have patients use this is to once you get in that position, count to 60, count to a minute. And you don't want to count like when you were playing hide and go seek as a kid, where you're going 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Don't count like that. Count slow. 1, 1,000, 2, 1,000. It sounds frustrating to count to a whole minute, but you really want to do it. And as you're doing it, you're paying attention to those areas that you're feeling a stretch on. And as you feel that stretch starting to ease up and go away because the muscle's getting more relaxed and lengthening, then you allow your leg to come over just a little at a time, slowly again, until you feel that stretch sensation returning. And you continue to count all the way to 60. So during a full minute, you may drop your leg a couple times during that 60 seconds. And if you have the luxury of time, what you may want to do is, if that leg is still starting to drop when you get to a minute, if you have time, hold it for another minute and see how far your pelvis and your low back are willing to relax ultimately. And eventually, you're most likely going to get to the point where your knee, this downside knee, is sitting on the floor eventually. As this really loosens up in rotation, it'll probably get much closer to the floor, if not on the floor. Okay, the best way to stretch, I always try and tell my patients, best way to do a stretch is every day, and when you're really recovering from an injury, if you can do it a couple times a day. You don't have to do it for the rest of your life. Do it for a week, 2 weeks, 3 weeks, something like that. Short term, you get more bang for your buck that way. A couple times a day, just one at a time. In other words, a minute, and then later in the day do it again. Okay, there we go.